Anyway, we could carry on the whole morning, but I know you've got another interview, Sakina, and a very big one in terms of Drug Awareness Week.
Indeed, a very important one, Leanne. It is Drug Awareness Week, and COVID-19, as well as the implementation of the national lockdown, has actually changed operations and finances of drug rehabilitation facilities across the country. Now, when the lockdown began, the South African National Council on Alcoholism and Drug Dependence, or SANCA, had an influx of text messages, and we told up to 500 in the first week. And these inquiries were mostly related to the ban on the sale of alcohol and cigarettes. So to discuss this, we're joined by Adrie Vermeulen, who is the National Coordinator at SANCA. Adrie, thanks for your time this morning. Welcome to Morning Live.
Good morning to you and the viewers.
Let's just first get a view of how this lockdown and the pandemic has affected your operations at SANCA.
I think, first of all, before it started, we were very confused about should we stay open or should we be closed, because we weren't sure if we were seen as essential services by government at that point. And we then had to close some of our centers stayed open. So it affected the access to treatment that people would have in the past. And that was one of the significant reasons why we had that influx of calls, people requesting help through that period. The hospitals were not doing any admissions during that time because of COVID-19 beds being allocated for that purpose. So there was really a panic, in the beginning stages of the lockdown that we saw. There was also an increase in requests from the shelters, especially from the government shelters, the temporary ones that they established, as well as the existing ones that wanted detox services, because now there was an influx of the homeless or the displaced people, and they were all going through withdrawal symptoms. So SANCA had to jump in and assist the Department of Health and Department of Social Development in various cities with those services. So our services changed dramatically since that time.
Now, Adrie, what kind of assistance were you able to offer during the initial period of the lockdown, especially?
During that time, we were only able to provide very basic services, providing online support services, counseling where we could, as well as then some of our centers that were open were able to still assist the clients that were still going through with the treatment programs. And then luckily for us, level 4, we started opening our treatment facilities. And this also had a further impact, because now we started seeing that we've had a decreased number of admissions. People were afraid to come to the treatment centers due to the infection scare that they might have. And another big part of it was people were very concerned about quitting smoking as well. So that was a big challenge for us at the treatment facilities. And also our bed capacity drastically reduced, so we couldn't help everybody. We had to halve our bed capacity to ensure social distancing was remained in our treatment centers.
Adrie, you also say that you were inundated. You had a veritable influx of text messages, especially in that first week of the lockdown. Are you able to share with us exactly what people were most concerned about?
Interesting for us, it was domestic violence. So we saw a lot of cases coming through during that period linked to gender-based violence that we've seen. So that was the request from many of them, is where do we go for help? My partner is abusing me and they're under the influence. And that is probably also because a lot of people stocked up just before the lockdown. So they were getting ready to not have alcohol, and then people would binge drink because now they're at home, they're bored, and the relationships are falling apart.
And that really, I think, is one of the concerns that we had as a nation about what the lockdown could possibly do. But it is now level 3, Adrie. How are your operations now, and what safety and health standards have you had to implement to avoid further spread of COVID-19?
We've had to implement protocols throughout our treatment centers where from the minute the client walks into the facility, they are tested, they are assisted, they go through initial screening stages, and then we have to isolate them for at least 7 to 14 days from any other clients that are in the treatment center. And that also, we incurred a lot of costs doing that because we have to provide PPE for our staff as well as for our clients to ensure their safety. We have to do the cleaning 4 times a day. Wherever the clients are meeting, those rooms had to be adjusted. So there was a lot of additional costs for our treatment centers that initially we didn't budget for.
And what programs or awareness activities are you able to do at the moment, Adrie? And I would imagine that your resources are constrained, but it is Drug Awareness Week. So what are you able to do at this point?
We're very excited about our Kick Your Habit campaign that started this week. And it is a personal experience journey that we challenge everybody to do, even your viewers, to say that you need to over the next 7 days that you have used as a crutch. Maybe also you've developed some negative habits, during lockdown, like excessive eating or eating too much chocolates and sweets. And this is an opportunity for people to realize that addiction is a disease. It affects all of us. And we all have something that we rely on to deal with our anxieties and our fears and our emotions. So we challenge people during these 7 days to be aware of that. And we've got a very big social media campaign that we've launched. It's been running for the last 4 years, so it's not a new campaign. And it's really to create awareness that it can be any one of us, and it really desensitizes people to the fact that addiction is there. It is there, it is part of our lives, and we can't quit. There is a whole process that needs to happen for you to stop that behavior that you are busy with. So that's the challenge for this week. We're looking forward to your viewers also joining us on our Kick Your Habit page. That's there, and it gives them tips every day of how to quit, and how to give up that habit.
All right. Adrie, thank you so much for your time this morning. Adrie Vermeulen is the National Coordinator at SANCA, talking to us about how the lockdown has affected their operations and finances.